Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be continuing our respiratory disorders. Today's asthma 25 questions with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 10-year-old child with a history of moderate persistent asthma presents with shortness of breath, wheezing, and intercostal retractions. The child is using accessory muscles to breathe and has a peak expiratory flow, PEF, rate of 45% of their personal best. What is the nurse's priority action? A. Encourage the child to perform pursed lip breathing. B. Administer the prescribed short-acting beta agonist, SABA, via metered dose inhaler with a spacer. C. Place the child in a supine position to promote rest. D. Notify the healthcare provider for possible intubation. Correct answer, B. Rationale: the child is exhibiting signs of an acute asthma exacerbation, indicated by reduced PEF, less than 50% of personal best, and respiratory distress. Administering a SABA like albuterol is the immediate priority. Pursed lip breathing, A, is more helpful in COPD. Supine position, C, can worsen ventilation. Intubation, D, is not a nursing action and not indicated yet without evidence of impending respiratory failure. Question 2. A 25-year-old patient with asthma is admitted with status asthmaticus unresponsive to initial bronchodilator therapy. The nurse notices a sudden decrease in wheezing and the patient becomes drowsy with shallow respirations. What is the nurse's interpretation of this change? A. The patient is improving due to medication effects. B. The airway obstruction is resolving. C. The patient is at risk for respiratory failure and requires immediate intervention. D. The patient is experiencing anxiety-related fatigue. Correct answer, C. Rationale: a sudden decrease in wheezing in a previously wheezing patient with asthma may indicate worsening airway obstruction and impending respiratory failure due to diminished airflow. This is a clinical red flag requiring immediate intervention. Improvement would be accompanied by other signs such as easier breathing and increased alertness. Question 3. A nurse is preparing to discharge a patient recently hospitalized for a severe asthma attack. Which instruction is most important to include in the discharge teaching? A. Use the corticosteroid inhaler only when symptoms worsen. B. Increase caffeine intake to help open airways. C. Schedule a follow-up visit within 1 year. D. Keep a daily symptom and peak flow diary. Correct answer, D. Rationale: keeping a symptom and peak flow diary allows patients to monitor control and detect early signs of exacerbations, improving self-management. Corticosteroids should be used regularly as prescribed, not only when symptoms worsen. Caffeine is not a recommended therapy. Follow-up should occur sooner than 1 year. Question 4. A nurse is caring for a patient receiving nebulized albuterol for acute asthma exacerbation. Which finding requires immediate action? A. Heart rate of 110. B. Serum potassium level of 3.2 milliequivalent per liter. C. Mild hand tremors. D. Productive cough with white sputum. Correct answer, B. Rationale: albuterol can cause a shift of potassium into cells, leading to hypokalemia. A potassium level of 3.2 milliequivalent per liter is low and may lead to dangerous arrhythmias. Tachycardia and tremors are common side effects, and white sputum is nonspecific. The nurse must monitor electrolytes during frequent bronchodilator use. Question 5. A nurse is caring for a patient with asthma who has been prescribed a long-acting beta-2 agonist, LABA, and inhaled corticosteroid. Which patient statement requires further teaching? A. I will use my rescue inhaler if I have sudden shortness of breath. B. I need to rinse my mouth after using my corticosteroid inhaler. C. I can use my LABA inhaler whenever I feel wheezy. D. I should continue my medications even when I feel fine. Correct answer, C. Rationale: LABAs are not rescue medications and should not be used for acute symptoms. Using them inappropriately can lead to delayed treatment of exacerbations. Rinsing after corticosteroids helps prevent oral thrush. Continuing controller meds is essential for long-term control. Question 6. During the assessment of a patient with asthma, the nurse notes the use of accessory muscles, inability to speak in full sentences, and oxygen saturation of 89% on room air. What is the priority nursing action? A. Administer corticosteroid IV as ordered. B. Prepare for intubation and mechanical ventilation. C. Apply oxygen and initiate high-flow nebulized SABA therapy. D. Reassess the patient in 15 minutes after rest. Correct answer, C. Rationale: the patient is in respiratory distress. The nurse must immediately provide oxygen and administer bronchodilators per protocol. Corticosteroids take time to work. Intubation may be necessary later, but the priority is to attempt to reverse the exacerbation with non-invasive measures first. Reassessment without intervention delays care. Question 7. A patient with asthma is started on montelukast for maintenance therapy. What is the most important information for the nurse to include during patient education? A. Use this medication during an acute asthma attack. B. Take the medication every evening even if you feel well. C. Monitor for increased heart rate after taking the medication. D. Take this medication with food to avoid GI upset. Correct answer, B. Rationale: montelukast is a leukotriene receptor antagonist used as maintenance therapy and should be taken daily, typically in the evening. It is not used for acute exacerbations. Increased heart rate is not a typical side effect, and food has minimal effect on absorption. Question 8. A nurse is caring for a patient with asthma who is on inhaled corticosteroids. The patient reports hoarseness and white patches in the mouth. What is the appropriate nursing action? A. Notify the provider to discontinue the inhaled corticosteroid. B. Educate the patient about rinsing the mouth after inhaler use. C. Encourage increased fluid intake to soothe the throat. D. Suggest using a throat lozenge after each dose. Correct answer, B. Rationale: white patches suggest oral candidiasis, a common side effect of inhaled corticosteroids. Rinsing the mouth after use reduces this risk. The medication should not be discontinued without provider input. Fluids and lozenges may help symptoms but do not address the cause. Question 9. A nurse is reviewing the medication administration record for a patient with asthma and notes the following PRN orders: albuterol, ipratropium, and prednisone. The patient is experiencing an acute exacerbation. In what order should the nurse administer the medications? A. Prednisone, albuterol, ipratropium. B. Albuterol, prednisone, ipratropium. C. Albuterol, ipratropium, prednisone. D. Ipratropium, albuterol, prednisone. Correct answer, C. Rationale: albuterol, SABA, should be administered first to open airways quickly, followed by ipratropium, anticholinergic, for additional bronchodilation. Prednisone, systemic corticosteroid, is used later to reduce inflammation. This sequence ensures optimal medication effectiveness. Question 10. A patient with a history of asthma controlled with fluticasone salmeterol is scheduled for elective surgery. Which preoperative concern should the nurse anticipate? A. The patient may require higher doses of rescue inhalers. B. The patient is at risk for adrenal suppression due to corticosteroid use. C. The patient should stop asthma medications 24 hours before surgery. D. The patient will not require any pulmonary assessment. Correct answer, B. Rationale: long-term corticosteroid use can suppress adrenal function, increasing the risk for adrenal crisis during the stress of surgery. Patients may require supplemental steroids perioperatively. Asthma meds should not be stopped before surgery. A pulmonary assessment is essential due to risk of respiratory complications. Question 11. A patient with a history of poorly controlled asthma arrives in the emergency department with labored breathing, respiratory rate of 34 per minute, and silent chest on auscultation. The nurse prepares for immediate intervention. Which is the most critical nursing action at this time? A. Obtain a chest X-ray to assess for pneumothorax. B. Place the patient in high Fowler's position and initiate oxygen. C. Administer IV methylprednisolone as prescribed. D. Encourage the patient to slow their breathing. Correct answer, B. Rationale: a silent chest indicates severe airway obstruction and impending respiratory failure. The immediate nursing priority is to optimize oxygenation by positioning and applying supplemental oxygen. Chest X-ray and corticosteroids are important but not first line in an emergency. Breathing coaching alone is insufficient in this context. Question 12. A patient newly diagnosed with asthma is being discharged. The provider orders a rescue inhaler, albuterol, and a controller medication, inhaled corticosteroid. What teaching by the nurse reflects best practice? A. Use your controller inhaler only if symptoms appear for more than 2 days. B. If both inhalers are scheduled, take the corticosteroid first. C. Use the rescue inhaler before the corticosteroid if both are prescribed at the same time. D. Take both inhalers at the same time every morning. Correct answer, C. Rationale: when both a rescue inhaler, bronchodilator, and controller, corticosteroid, are prescribed together, the bronchodilator should be used first to open the airways, allowing the corticosteroid to be more effectively absorbed. Corticosteroids are not PRN. Question 13. A nurse is caring for a 30-year-old with asthma who reports taking albuterol inhaler about 10 times in the last 24 hours. The patient is restless and complains of palpitations. Which action is most appropriate? A. Document findings and reassess in 1 hour. B. Prepare the patient for an EKG and notify the provider. C. Instruct the patient to avoid caffeine intake. D. Provide reassurance and monitor vital signs every 4 hours. Correct answer, B. Rationale: overuse of albuterol can cause tachyarrhythmias and hypokalemia. Palpitations and restlessness may indicate serious side effects. The nurse should prepare for cardiac monitoring and notify the provider for further evaluation. Question 14. A nurse is reviewing the plan of care for a patient admitted with an acute asthma exacerbation. Which nursing diagnosis should be prioritized? A. Risk for activity intolerance. B. Anxiety related to hospitalization. C. Impaired gas exchange related to bronchospasm. D. Deficient knowledge related to medication regimen. Correct answer, C. Rationale: during an acute asthma exacerbation, impaired gas exchange is the most life-threatening concern and should be addressed first. Other diagnoses may be valid but are lower in priority based on Maslow's hierarchy and ABCs. Question 15. A nurse is assessing a patient with asthma who has been taking oral corticosteroids for the past month. Which finding requires further evaluation? A. Blood glucose of 165 mg per deciliter. B. Complaints of increased appetite. C. Round facial appearance and acne. D. Temperature of 101.2 degrees Fahrenheit 38.4 degrees Celsius. Correct answer, D. Rationale: long-term corticosteroid use suppresses the immune system, increasing infection risk. A fever is a red flag and requires evaluation. Hyperglycemia, weight gain, and Cushingoid features are common side effects but not immediately dangerous. Question 16. A patient using a dry powder inhaler, DPI, for asthma asks how it differs from a metered dose inhaler, MDI. What is the nurse's best response? A. DPIs deliver medication more quickly and require less coordination. B. You must shake the DPI before each use to activate it. C. Use a spacer with your DPI to ensure proper delivery. D. Hold your breath for 3 seconds after inhaling the powder. Correct answer, A. Rationale: DPIs are breath activated and require less coordination than MDIs. They do not require shaking or a spacer. Patients should hold their breath for about 10 seconds after inhalation for best effect. Question 17. A nurse is monitoring a patient receiving frequent albuterol nebulizer treatments. Which assessment finding indicates a potential adverse effect that requires intervention? A. Capillary refill of less than 2 seconds. B. Pulse oximetry of 94%. C. New onset muscle cramps and weakness. D. Respiratory rate of 20 breaths per minute. Correct answer, C. Rationale: frequent albuterol use can cause hypokalemia, leading to muscle cramps and weakness. These are concerning symptoms and should prompt electrolyte evaluation. The other findings are within normal limits. Question 18. A patient with asthma is scheduled for a pulmonary function test, PFT, tomorrow morning. What should the nurse include in the teaching? A. Eat a light breakfast before the test. B. Take your rescue inhaler 30 minutes before the test. C. Avoid using bronchodilators 6 to 12 hours prior to the test. D. Drink plenty of caffeine to stimulate airway clearance. Correct answer, C. Rationale: bronchodilators should be withheld before baseline pulmonary function tests to obtain accurate measurements of airway obstruction. Inhalers can be used afterward to assess reversibility. The test is usually done NPO or light intake. Question 19. A patient hospitalized with an acute asthma exacerbation is improving. The nurse notes the patient is now experiencing productive coughing and wheezing. What is the appropriate interpretation? A. The patient is progressing to pneumonia. B. The patient is experiencing worsening airway obstruction. C. The bronchodilators are effective in mobilizing secretions. D. The patient should be placed on contact precautions. Correct answer, C. Rationale: as bronchodilators improve airway patency, patients may start to mobilize secretions, which often leads to increased coughing and audible wheezing. This is a positive sign of treatment effectiveness and not an indicator of infection or worsening. Question 20. A school nurse is educating a group of teenagers with asthma about exercise-induced bronchospasm. What statement indicates a need for further teaching? A. I should use my rescue inhaler 15 minutes before running. B. If I start wheezing during PE, I should stop and use my inhaler. C. I don't need to take any inhaler if I'm only walking. D. Warming up before exercise might help prevent symptoms. Correct answer, C. Rationale: even mild activity like walking can trigger symptoms in sensitive individuals. All patients should follow their provider's recommendations for inhaler use before activity. The other statements reflect correct self-care. Question 21. A nurse is caring for a patient with asthma who reports daily nighttime awakenings due to coughing and wheezing. The patient is currently prescribed a low-dose inhaled corticosteroid. What should the nurse anticipate as the next best action? A. Administer a rescue inhaler before bedtime. B. Switch to a short course of oral corticosteroids. C. Recommend stepping up to a medium-dose inhaled corticosteroid. D. Instruct the patient to avoid allergens before sleeping. Correct answer, C. Rationale: frequent nighttime symptoms indicate poor asthma control. According to asthma management guidelines, stepping up controller therapy, i.e., increasing the corticosteroid dose, is the next appropriate action. Rescue inhalers are for acute relief, and oral corticosteroids are used for exacerbations, not routine control. Question 22. A patient with asthma receives education on avoiding triggers. Which patient statement indicates the need for further teaching? A. I will vacuum frequently using a HEPA filter. B. I'll keep my windows open to let fresh air in year-round. C. I'll wash bedding weekly in hot water. D. I'll avoid using aerosol sprays and scented products. Correct answer, B. Rationale: keeping windows open can allow pollen, mold spores, and outdoor pollutants into the home, which are common asthma triggers. The other statements reflect appropriate allergen reduction strategies. Question 23. A nurse assesses a patient with asthma who is speaking in 1 to 2 word phrases, has nasal flaring, and an SpO2 of 86% on room air. Which action should the nurse take first? A. Call a rapid response. B. Start high-flow oxygen therapy. C. Administer corticosteroid as ordered. D. Elevate the head of the bed and monitor respirations. Correct answer, B. Rationale: the patient is in severe respiratory distress with hypoxia. Immediate administration of high-flow oxygen is the priority to restore oxygenation. Rapid response may follow if the condition deteriorates further. Corticosteroids are not immediate acting. Question 24. A patient admitted for an asthma exacerbation is started on albuterol nebulization every 2 hours. Which finding should the nurse report to the healthcare provider? A. Blood pressure 130/82 mm of mercury. B. New onset frequent PVCs on telemetry. C. Slight hand tremors post-treatment. D. Respiratory rate of 22 breaths per minute. Correct answer, B. Rationale: premature ventricular contractions, PVCs, may indicate cardiac irritability due to excessive beta agonist use or hypokalemia. This is potentially dangerous and must be reported. The other findings are within expected parameters or are common, mild side effects. Question 25. The nurse is caring for a patient with asthma and notes a respiratory alkalosis on arterial blood gas, ABG. What is the most likely explanation? A. The patient is retaining carbon dioxide. B. The patient is in early respiratory fatigue. C. The patient is hyperventilating. D. The patient has developed metabolic compensation. Correct answer, C. Rationale: during early asthma exacerbation, patients often hyperventilate due to anxiety and hypoxia, blowing off CO2 and causing respiratory alkalosis. As fatigue sets in, CO2 retention and respiratory acidosis may follow.